Midland Memorial is feeling the strain of more hospitalizations, and it's not just the adult population. Our pediatric unit is already over capacity with few options to move kids elsewhere. Everybody in the same boat. Jonathan joins us now with more on this situation. Hi, Jonathan.
Good evening, Tatum. Midland Memorial Hospital only has 12 pediatric beds available at any given time, and all of those beds, well, they're currently occupied, and more kids are being cared for in the emergency room. Now, Midland Memorial's Chief Nursing Officer, Kit Bredemus, said that we need to go back to practicing those mitigation efforts in order to alleviate the strain on the pediatric unit. As hospitalizations rise in Midland, we're seeing more and more kids end up in the pediatric unit.
When you look at the demographics across the state right now, you do see that pediatric hospitalizations are on the rise across the entire country and across the state in a significant fashion, more than we've seen in previous waves. And I think that is definitely concerning this time around, recognizing that in previous waves, we had other mitigation factors in place.
A full pediatric unit, something Midland Memorial hasn't seen during the pandemic.
Since the pandemic, we have not seen our pediatric unit full. In fact, in previous waves, we were looking to close down the pediatric unit because we just didn't have a whole lot of population there. Prior to COVID, there were instances, bad flu seasons, bad RSV seasons where we may fill up on a pediatric unit, but I've never seen it fill up this quickly.
But transferring kids to other pediatric units has proven to be a problem.
As you know, hospitals across the state are filled. Also in the pediatric units, our pediatric hospitals across the state are also over capacity. So at this point, we are continuing to look at hospitals across the country that may be able to take patients, but at this point, we have not been able to identify.
Bredemus says that the best thing we can do is practice mitigation efforts.
We want to see the best for our kids. We want to see the best for all of our patient population. So it is going to be very important to, again, go back to those mitigation practices that we had. Children under 12 cannot get vaccinated. Anyone over 12 years old can get vaccinated and should.
Now, it is important to note that not all of the kids in the pediatric unit are COVID positive. It's a mixture of kids with COVID, RSV, and other respiratory illnesses. Reporting live in Midland, Jonathan Polasic, News West 9.